Assalamu alaikum wa rahmatullahi wa barakatuhu. How is everybody today? Jazakallah khairan kaseera for coming for this webinar that the Civic Engagement Department of ICNA Sisters has arranged. So I will begin with the name of Allah and then we will start. Allahu Rabbi la ushrika bi shay'in. Allahu Akbar kabira walhamdulillahi kathira. Allahumma salli wa sallim nabiyyina Muhammad wa ala ali Muhammad. Rabbi shrah li sadri wa yassir li amri wahlul uqtadam min lisani yafqahu qawli. So welcome everyone. Today the webinar is all about autism. But before I begin the webinar, let's do the land acknowledgement. So we ICNA sisters acknowledge that the indigenous peoples are the traditional guardians and owners of this land that we all call Canada. We would like to honor all the ancestral stewards of this land on which we meet today and their descendants living in over 1,000 different tribes, nations, communities, and native villages. These people speak almost as many different languages as there are tribes. We ICNA sisters acknowledge and we want to work to dismantle the ongoing violence and repercussion of the indigenous peoples and their culture. So let's begin. So I would like to introduce, I would like to tell you a little bit about ICNA sisters. The word ICNA stands for Islamic Circle of North America, and we are a faith-based, all-women organization, and we all are volunteers. And alhamdulillah, we have 28 different cities. We have chapters in 28 different cities all over Canada. And we are something like almost 1,300 plus members, and we are all volunteers. And we believe in, empowering women. And one of the ways we do our work is we divide ourselves into different departments. And the department that has taken the role of bringing you this webinar today, which is about autism, is the Civic Engagement Department. And we believe in, empowering the women. So we want to help our members or anybody else that has joined us who is not a member and inshallah a future member maybe one day, that helping understand, because April is the Autism Awareness Month. So that's why we were holding this webinar today. And alhamdulillah, we have Dr. Muniba Faraz with us. Inshallah, I will introduce her after. But before we introduce Dr. Muniba, we would like to start our webinar with the Quran, reading of the Quran. And so I would like to introduce Sister Abida Batul, and she is an MGA of ICNA Sisters, and she is a mashallah amazing member of for 15 years now. She lives in Oshawa, and so Sister Abida Batul will read you the meaning of the ayahs that we have picked today relating to our topic, and she will also read the meaning. So Sister Abida Batul, the mic is all yours.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم هذا بيان للناس وهدى وموعظة للمتقين ولا تهنوا ولا تحزنوا وأنتم الأعلون إن كنتم مؤمنين يمسسكم قرح فقد مس القوم كرح مثله وتلك الأيام نداولها بين الناس وليعلم الله الذين آمنوا ويتخذ منكم شهداء والله لا يحب الظالمين. صدق الله العظيم. In the name of Allah, the most beneficent and the merciful. This Quran is a clear statement to all the people and guidance and instruction for those conscious of Allah. So don't weaken and don't grieve. You will be superior if you are true believers. If a wound should touch you, there has already touched the opposing people a wound similar to it. And those days of varying conditions we alternate among the people, so that Allah may make evident those who believe and may take to himself from among you martyrs. And Allah does not like the wrongdoers. Sadaqallahu Azim.
Jazakallah khair, Erin Kathira, Sister Abida Batul, for the beautiful recitation and the meaning. I would just like to explain a little bit of the ayah, why we picked it. The ayah number, the main purpose of our speaking this ayah was the meaning, which is ayah number 139 from Ali Imran, Surah Ali Imran. And it says, do not be weak of heart and do not grieve, for you are always the superior, always are on the superior side if you are true believers. So this relates to the topic a lot today because, as you know, we don't understand autism very well, and there are many other diagnoses of other brain functions which are different than ours, and we don't understand it, and we kind of have a way of looking down at it. And so one of the main reasons, and there's a big stigma attached to it. So one of the reasons, with knowledge, we always, when we don't understand something, we always think it's the worst. That's the human quality that we have, that when we don't understand something, we judge them as something that is wrong because they're not like us. But as we know from this ayah, that Allah says that, we shouldn't, if we have somebody that's different with us, or we are the ones who are different, we should not grieve or feel as if we are weak. No, it's because, we all know as a Muslims that life is a test. So Allah tests us in different ways. So having these kind of conditions, which are many other ones, not just autism, and inshallah, we will continue different webinars and deal with each different conditions if time permits, and we find people who can talk about it, inshallah. So we will find out that, Allah tests us, and this might be a test. And also the stigma that comes with it, just because we think, oh, these people are not, not normal, or there's something missing in it. But from as a Muslim perspective, we should know that this is not a disease. It is just that the word that is used is neurodivergent. So their brain is just functioning in a different way. So they are not something wrong with it. It's not a disease. It's just a different it's a different way that their brains are working. And for us to understand them and be able to help them and not stigmatize them, we should understand what it is and how their brains are functioning and how to help them so that we can help bring out the best in them. Because early detection And even if it's not early detection, but know how to help them lead a full life. And that's why we are holding this webinar today. Inshallah, you will learn a lot from Dr. Muniba Faraz, and we will be able. And then one of the thing is that we will not disturb her while she's presenting. So if you have a question, then you can always write it in the chat, and we have sisters who are going to write it down. And inshallah, in the end, Dr. Faraz will, Muniba Faraz will answer all the questions, inshallah, if time permits. But you just have to write it in your chat. And in the end, we will try to ask as many questions as they are prevalent and they're important to the webinar, inshallah. So let me just introduce to you about who Dr. Muniba Faraz is. MashaAllah, amazing degrees. Look at all the little numbers under her names, all the little letters, subhanallah. So Dr. Muniba Faraz completed her MBBS, which is Medical Studies, in Karachi, Pakistan. Dr. Faraz completed her specialist training in Ireland. How interesting. I would love to go to Ireland. Ireland are very, mashallah, very pro-Muslims now and pro-Palestine. So I love them right now. She attended her MRC Psych degrees and completed her master's in conjunctive behavior therapy from Ireland, UCD Ireland, and a diploma in medical education from Belfast, UK. Then she moved with her family to Prince George, British Columbia, working at UHNBC under the Northern Health Authority as the sole physician, where she was managing adolescents and youth inpatients, psychiatry. Then Dr. Faraz completed a fellowship in adult psychiatry and further proceeded to complete her fellowship in child and adolescent psychiatry. Then now she's relocated to Fraser Health, where she is playing a vital role. In her personal life, Dr. Faraz enjoys spending time with her family, and she has, mashallah, 3 children, and she tries to integrate Islamic values in the community as well as in her family. So the mic is all yours, Dr. Faraz. Let's learn about autism, and best of luck with everything. Jazakallah khair for coming today and giving us your time.
Thanks for a lovely introduction there. So thanks everyone for joining and giving me the opportunity to talk about this very important topic. I see there are a lot of participants there, and yes, I'm going to continue with my presentation first and would be open to take some questions. So before I start, like I was told to talk about autism, but it's such a diverse topic. And I think so it's such a difficult topic that even if I see with a lot of my colleagues that they miss the diagnosis, very commonly missed diagnosis. And although sometime when we see kids when they're 17, 18, and we are treating for so many other diagnoses, not knowing the underlying problem is autism. So very key thing. And so I've tried to explain the basic information about autism as much as possible, and then we'll welcome some questions about it. So let's start. So what is autism? So autism is previously known as pervasive developmental disorder or a neurodevelopmental disorder, which is a lifelong condition. And it is characterized by impairment in 3 areas, which is the communication, social interaction, and responsiveness. Now, this is the definition. I took it from a book, which we read as our DSM criteria, but I'm going to tell more in kind of a depth about what does actually this mean. So first of all, what is the neurodevelopmental disorder? So neurodevelopmental disorder means that they're caused by abnormality in the way the brain develops and works. So it's the way that there's some dysfunction or some kind of a pause or gap or variability in the development of the brain, which leads to function in a different way than any other individual. So some facts about autism. So the onset is usually early childhood. Now, when I say this again, I keep on reminding people that these are the facts that we learn from the book. But when we go to the practical life, yes, onset is in early childhood, but the diagnosis sometimes is not in the childhood. And we can talk more about it. characteristic may be detected in early childhood, but autism is often not diagnosed until later in development. Child may show delayed development for up to age of 2 years. Some of the symptoms are more prevalent in 2 to 3 years of age, which are very typical in the spectrum, and we can talk more about that too now. Some children with autism may develop normally until the toddlerhood, or when they stop acquiring or start losing some previously gained skill. So I can talk more about this spectrum thing, which is slide is coming down, that autism can present early childhood, but some of the symptoms may not present in earlyhood as well. And that's something can lead to difficult diagnosis. So some of the names, that autism is also known by a lot of other names. If you see in the media or book, such as autism spectrum disorder, Asperger's syndrome, autistic spectrum condition, pervasive developmental disorder. So these are a lot of names. Now, Asperger's syndrome is used to be a previous diagnosis in DSM-4, but that's not being used anymore. But these are the different names that is normally called. So prevalence rate. So autism could be present in 1 in 100 children, but a lot of stats and USA studies have shown that it's increasing. Some of the studies have also shown there's 1 out of 59, but this 1 out of 100 is more recently studied number. Autism affect more boys than girls. So 4 male for every 1 female. So 1 out of 39 boys. These are just the stats. Again, I took it from the book. So autism is more prevalent, again, for the knowledge, in boys, and 1 out of 152 girls. Now, one thing I just like to put some numbers here, but again, the intellectual disability or intellectual ability. There's a very common myth about autism that all the kids with autism are disabled or their IQ level is quite low. But a lot of studies shows that only 31% have an IQ level lower than 70, which means then 25 range in borderline, like in the middle to lower range, and 44, which is almost to the middle. The half of the kids with autism have average or may have above average IQ, which means that a lot of kids we see in our community who are very high functioning could have autism. And that is a common thing that leads to a lot of missing the diagnosis, because a lot of families think that the child is doing perfectly great in school, having good grades, but their social skills, their communication skills, that's something is missing. And that is what is the basis of autism is. So some of the causes or the risk factors, like if you say what causes autism, now that is the most common asked questions. Obviously, there are some of the things which are listed in theory, but a lot of people say that we don't know. So first of all, the link is genetics, monozygotic twins or first degree relatives, viral infection, medication, or some of the complications are linked to development of autism in children. Some prenatal exposure to valproic acid. Again, these are some of the causes, and they are not that if you're exposed, that you are going to get it. Again, there are some of the studies which have shown the link to the occurrence of autism. Family history of autism is very important, more common among boys, as I mentioned above, and some premature babies have seen some incidents of autism more. So some facts before I go into more detail about the symptoms and how does it present, I just want to lay out some facts about the autism. So it's a lifelong condition and it affects people from all the background, because normally there is a conception that some of the disease are in white people, some of the disease are in different races, but autism is prevalent in every background. Currently more female than males, males than females. The abilities and needs of the autistic people can vary. And that's a key point here and can evolve over time. While some people with autism can live independently, others have severe disabilities and require some lifelong care and support. This point that the ability and need of the autistic people vary, it's so vast and so diverse. And that is the main reason that so many autism kids can function so well that leads to missing of the diagnosis till even their teens or even their adults. Some of the kids with intellectual disability may be quite non-functioning from the very first year of their life and could be easily diagnosed. So that variability leads the diagnosis difficult. Many people are unaware that they have autism or autism spectrum disorder. And this is sometimes especially for adults. And I can talk more about that too later. So I just put some slides around the signs and symptoms of autism in toddlers. So these are the signs and symptoms which normally, again, they are very from the books which is very clearly present. Some of those early signs of autism could be that no babbling or pointing at 12 months, not responding to sounds, voices, or names, eye contact or avoiding the eye contact, do not smile back. That's a key thing. Does not like to be cuddled or don't show any sharing interest. No two words by 24 months, spinning, aligning objects, tendency to stare at lights or ceiling or fans or hand flapping. Now, again, these signs could be very unspecific, and we could have a lot of kids with those signs, but that doesn't mean that they have autism. But that does mean that if you have a toddler within 24 to 24, 12 to 24 months, these are the signs to be looking at, which is something to be aware that yes, sometimes it could be just a normal development because not every child develop in the same way. But again, to keep those in mind that if are they there, that's something to keep an eye on. So let's more dig into how the autism spectrum disorder present. And there are a lot of professional or hard words, and I've tried to make it as much simple as possible because, as I mentioned earlier, that understanding how the autism present could be very difficult. So these are the three main criterias that all the books or our diagnostic criterias label, and I'm going to go more into them. So number one thing is difficulty interacting with others, or what we call as poor social interaction. So they may have reduced interest in other people, poor eye contact. Now, this is something that we have a child in a class who doesn't like to be communicating, doing well in the school, always sit alone, always, and it's been labeled, oh, he's a shy kid. Yes, he could be a shy kid, but there might be something underlying as well there, which might be missing. The second thing is difficulty communicating, poor communication skills. So what communication skills means that they sometimes cannot find a word to start the conversation, delayed or no speech. Sometimes they have delayed speech, which is very easily picked because if a child is not speaking by 3 4 year old, all the parents may be concerned and their expression, but sometimes it's the expression of words or finding the words to speak is also difficult. And the third thing is restricted or repetitive behavior, unusual interest, rituals, hand flapping. So restricted or repetitive behavior, sometimes you find the kids with autism, and I can talk more about it in the next slide too. So let's dig more into what is poor social interaction or poor social communication. So some of the examples are they're usually very quiet and alone. The lack of social reciprocity, which means that abnormal social approach. So sometimes people describe them that he's very weird or she's very weird. Like the way they talk or start socially, any interaction, they could be very weird. They lost in their own world. They reduce eye contact, lack of facial expression. They could be very blunt. Lack of response to the name sometimes. Does not express feelings and emotions. Again, kids with autism have a hard time understanding their own feeling and difficulty expressing those emotions. And that is a key thing. Can appear to be unaware of the feelings of other. And that's why this is normally the parents come to the clinic and say that he doesn't understand that I'm angry, or he doesn't understand that I'm so upset or mad on him. He doesn't seem to care about it. But actually, the problem is that he's not caring because he's not understanding, because this is the way the brain is. They sometimes have a hard time expressing themselves, and that could lead to expressing themselves by crying or screaming, which is again lead to this difficult behavior. They could have abnormal tone and rhythm, like sometimes they have very peculiar way of talking or peculiar way of voicing out. They fail to respond, appear not to hear to you. Again, that's something that people also lead to a lot of normal kids when they come to the clinic and they go to the doctor and they say, my son is not responding. They set for the hearing test, and that's a key thing there too. That should be ruled out. But sometimes there does not appear to hear to you because this is again the way the brain sometimes doesn't give them signal that they have to respond back. And that's the main error in the kids with autism. They resist cuddling, holding, doesn't want any physical touch, prefer solitary activities and play alone. They have inability to start or sustain the communication. They have inability to use or understand the social cues. That's again could be that sometime if somebody's getting angry or upset, people can read the emotions. They have a hard time in reading other people's emotions. And they're uncomfortable in social environment. And that's what lead to a lot of social anxiety. And I can talk more about that. And that's why a lot of in our mental health clinic, the presentation to the clinic is extreme social anxiety. The kid is unable to go to school. There's this extreme school refusal, and they have been treated for social anxiety for years. But when you dig in and take more history, you find out the main diagnosis is autism, and that's been missed for years. So restricted behavior, interest, or activities. So there could be some repetitive movements such as spinning, rocking, hand flapping. Now, these are just some examples. Again, there could be a variety of things which the kids of ASD can present with. There could be, I have heard that they are putting things in line, the pillow need to be in line, or that when they're going down the stairs, they have to count the number of the stairs, that there are different routine or structures they follow. Get easily disturbed with change in routine or environment. And that's normally a very common thing which I see in my clinic. They could be very rigid. Any transition or change in structure, routine, or adjustment to change is huge, leading to a lot of behavioral issues. And that's sometimes the parents' main presentation to the clinic is that whenever we are going somewhere and the plan is changed at the last minute, my son throws temper tantrum. And I don't know what to do. He doesn't listen. And we tell them, and then all the kids are okay with the change, but he's not. So that's a key thing to put in mind, that if a child is not easily adjusting to any change, something to look into. Very rigid or inflexible, again, could be very stubborn. They could have a very black and white thinking, either this or this, nothing in between. Again, and that's why sometimes a lot of we see kids with parents complaining, my son doesn't listen to me. He's not very flexible. He doesn't listen. So that could be a main symptom of autism. And unfortunately, the parents are not aware what's happening with their children. Indifferent to pain and temperature. I can talk more about the sensory issues. Next slide. Fixation to object, toys, or activities. So fixation, again, I see a lot of parents complaining that my son is obsessed about dinosaur and everything is dinosaur. They have to buy the clothes, they have to take clothes, or they're fixating with certain eating. My son can only eat chicken nuggets, and that's all he can eat. So these are the variety of symptoms they can present with. Has a specific food preferences, which I just mentioned, and problem with coordinated movement. Sometimes they have a struggle in handwriting or poor handwriting, or fine motor or gross motor skills could be issue as well. And the fourth thing, which is normally is very key thing I just find with all the kids with autism is very common, is the sensory difficulties. So what happens is that the individual with autism may be very hyposensitive or hypersensitive. And the question arises, what is the sensory difficulty? So sensory difficulty is that very much sensitive to loud noise or touch or texture of the clothes they wear, or maybe very loud sound or different smell. And that's why they don't want to go in a public, because they cannot bear the smell or they cannot bear the noises. So the kids with autism, sometimes their sensory issues could be quite hypo or hyper. And all senses, which means touch, seeing, listening, hearing, all the senses may be affected. And this overstimulation may trigger, and that's why sometimes parents feel like when they go to the crowded place, my son has started screaming. So they don't understand what's happening there. Is this because the overstimulation or noises going to the mall can trigger them? And parents feel it's an out of blue reaction, but they don't sometimes understand that sensory overloading in any of those large environment can irritate them. And once they've been told what's been happening, things could be day and night difference. You can understand if you know what's happening with the child. So that's a key thing now, the understanding the spectrum. So all the symptoms I listed above, any child with autism does not necessarily mean they're going to have all the symptoms. It's in a spectrum. So It could be like somebody who's standing at 1 or somebody is standing at 100. It's a broad range in which all kids can fall. Somebody could have one symptom, somebody could have 10, somebody could have a 1.5, or somebody could have 99. So depending, every child present differently. This is a wide range of skills possible with autism. So some people with autism have an excellent vocabulary and high IQ, but limited conversational and social skills and restricted interest. And that's why there's a lot of saying that a lot of those professors who are sitting in their office publishing a lot of journals and books, it's a lot of research that they have autism because they have very high IQ, they have very high vocabulary, but they are enclosed in an office. They cannot take in conversation, they cannot talk, they cannot interact with people, but they have autism. Others may be nonverbal or with a very low IQ. So again, as I mentioned before, that their 31% could have limited IQ, but there are 44% of the people with a very good or way above normal IQ. So again, the symptom of autism spectrum disorder often change with age as well. So that's make us difficult as well when we're taking the history. Parents say that when he was 5, he does not have this, but now when he's 13, he have this. So the symptom can vary with ages as well. And again, not all people with delayed language or behavioral issues have autism. And again, this is another misconception that sometimes when a kids have difficult behavior, it's been labeled as autism, but it's vice versa. They could or they could not. And again, any child with some behavioral difficulties need to be assessed. So there's a well-known saying in the autism community is that if you've met one child with autism, you have met one child. Each child possesses their own unique differences, strengths, and challenges. And for that piece, I can talk that even I just saw a family a few months ago when their younger son was already diagnosed with autism, and the older child was almost 18. And mom and dad cannot say, and he has some lifelong difficulties, but parents were confirmed because they did not match the symptom with the younger son that he may not have autism. But when the child was explored and assessed, he was meeting the criteria, but parents were surprised that they knew about the autism from the very first day, but their both children were so different and they cannot feel or they cannot even identify that this is an autism again. So again, each child possesses their own unique differences, strengths and challenges. So that doesn't mean the two people can present in the same way. So spectrum describe the range of challenges that each child with autism may face. Again, it's a common misconception that children with autism are not affectionate and prefer to be alone. The truth is that many children with autism also love to be around people and to be kissed, hugged, chased, and tickled. And again, this is a kind of contradictory what I just said above, that they doesn't like to be hugged, they doesn't like to be touched. But this is, again, it could be different for different kids. But just as with any other kid or child, everyone has their own individual need, desire, and boundaries. And I just put some more slide on that because this is something that a key thing even the professionals misses because they feel like, oh, the child is having a good eye contact. He was talking, he had friends. How could he have autism? No, it could be very different for different individual. So I just like to talk a little bit more about some comorbidities. So comorbidities means
Dr. Munira, sorry to bother you, but could you please turn on your camera? You forgot it.
oh, okay. Sorry about that. Thanks for reminding. So comorbidities means that the occurrence of two disorder at the same time. So autism can present with other illnesses at the same time as well. And some of those illnesses are AHD is very common, which is commonly associated with autism. And AHD sometimes is a main leading cause, which can bring the parents to the clinic because they say my child is very hyperactive. And when you do a full assessment, you feel like ADHD is not only the concern there, maybe there's underlying autism. Some of the other illnesses such as social anxiety, depression, manic disorder, bipolar illnesses, tic disorder, personality disorder, selective mutism. The kids with autism sometimes present with selective mutism, which is a condition in which child is completely functional and talking at home, But in a school or any of the social situation, they are completely mute or they are not talking at all. Now, selective mutism could be in itself a own diagnosis, but it is very much occur in occurrence with autism as well. Eating disorder and substance use disorder. Now, this slide has so much information on it, and I can take days to talk about everything, but today our topic is mainly about focusing on autism. So I just put a slide to say that autism can present with other illnesses too. So that's a key thing I just want to highlight about autism spectrum disorder and mental health. So most of the time, primary presenting problem may be a mental health concern. And that's something common which I always see in my clinic. The kids are being referred because of extreme anxiety, developing depression, obsessive compulsive disorder, or maybe parents will bring to the child that my child is very oppositional. He's very defiant. He doesn't understand what I'm saying. And he had a hard time adjusting to the change. He's not very flexible. Or eating disorder or paranoia. So sometime or most of the time, as I mentioned, in clinical practice, we see the presentation is not the autism symptom, the presentation is mental health illness. And this is the problem is that child has been struggling with those issues, not been understood by family, by relatives, by school, leading to a lot of difficulty for them to understand and survive in this world, leading to depression and extreme anxiety. So primary symptom problem may be mental health concern. This can interfere with daily functioning and cause more distress than ASD symptoms. So the primary mental health diagnosis causes more problem than ASD, and that's why the key thing is identifying and getting an early treatment, which I'm going to talk more now. So I just want to put this slide. Sorry. I just want to put this slide, some of the quotes I took from the family, that what the families normally talk about. So my son has taken a stranger's food right off his plate. What could I possibly say? I don't know the last time I've actually seen the end of the movie because of the crowd, lights, noise. It just become too difficult and we have to leave. Simple situation like haircut, grocery shopping, community gathering is not so easy for us and we have a hard time doing all those things. I don't want sympathy, pity, or folks saying, oh, I'm sorry. What I need is for people to be patient, kind, and understanding. So these are some of the quotes that the family kind of say about their children with autism. So let's talk. I just want to put this slide very clearly because autism and behavior. So the most common thing which we hear from our parents is about, my child doesn't listen to me. My child doesn't understand when I ask him to put on the shoes. It's so difficult to get him dressed and get out of the room. He's so difficult in the morning. So the parents come with the behavior, and when they're talking in front of me, I know this is a symptom of autism, but because of the poor understanding or not having to know about the autism. So I just want to put this slide here that the children with the autism spectrum disorder can often have a hard time, difficulty, or expressing their feeling as well as communicating with others. So they don't know how to communicate or tell others what they're thinking or feeling, or understand other people's feeling as well. Now, when they don't feel understood, this leads to a lot of aggression, frustration, and possibly temper tantrums. As a result of this, children are unable to express what they really want. This often results in behavior difficulties. So, given that mother or father does not understand what the child is asking, and the child does not have a way to communicate, this results in a lot of behavioral challenges. So the impact on family life. What this lead to? Harder to get things done because of the excess demand, strain on marital and personal relationship, increased demands on family members, minimal respite options, burnout, and depression can as a result, strain and changes to employment of the parents or caregivers, increased financial burdens from issues relating to employment therapy. So mom and dad have to take a time off. My child is having huge temper tattoos. Nobody wants him in the school. He's so difficult with his siblings. I have to take time off the work. So it takes a lot of toll on the families. So what to do? What to do if you think you may have autism, your child have an autism? What to do from there? If you're a parent who is concerned that your child may have autism, you're already doing the right thing by getting online and researching how to help your child. The problem is that many parents of children with autism are told by their family, friends, teachers, family doctors, or others that love them that they shouldn't worry. Your child is just a late bloomer, or maybe he'll grow out of it. He's just hyperactive. Maybe he'll be fine. And Einstein didn't speak until he was 4. So a lot of these things are being set aside, or maybe not being taken that seriously. Coming to terms that your child may face developmental challenges is scary, and it's tempting to reject the truth and just hope that it'll be all okay, he'll be fine next year. A diagnosis of autism, however, will allow you to access the support your child needs sooner and learn how you and your family and friends can best support them. That's a key thing here. So getting a diagnosis helps so much. There is no any medical exam or blood tests that can diagnose the autism, but there are definite signs that can flag an autism spectrum disorder, which we just discussed above. By observing those signs and examining a child's behavior and development, a psychologist can make a diagnosis of autism and then can put you on the right path to help your child as quickly as possible. So, what to do if you notice those signs in autism in your child? So, most of the parents, when they come to me, even when the child is even 14, 15, they say that I knew from the very first day there's something wrong there. They said that they knew there's something off there, but they don't know what was that. So if you have this feeling that your child is displaying some odd symptom or some sign of autism, the earlier you get the help for your child, the better. So the first step is to address your concern is making an appointment with your family doctor for a developmental screening to see if there's any delay in their basic skills. Your family doctor or a developmental pediatrician, doctor who has specialist training in child development and child with special needs, or a child psychologist can also diagnose with the autism. If you have a doctor who say, I don't know anything about it, then ask a referral for someone who does that, because the family doctors know the information. And then that's a key point, which I've written in 2 words, which is not easy, is from there you want to research the different types of government funding, support, and programs available in different areas to guide your child to their full potential and to support you as a parent in understanding the need of your child. So I work in British Columbia, Vancouver, and then we have a government body called Sunny Hill. But I do these presentation, or I educate my parents to go in assessment, but normally there's a couple of years of wait list. But there are still some private agencies who do those assessment. And in our province, I don't know about the other provinces, once the child is being diagnosed with autism, they are eligible for some level of funding from the ministry. And that funding could be used to help hire a behavioral consultant or behavioral interventionist or occupational therapist to help your child. So I always emphasize parents to get the diagnosis earlier so they can get that funding, which is they need, and they can use it for different services for their child. Now, for other provinces, that's something, guys, I know everybody's attending from all over the Canada. The key thing is that you need to go and talk to the family doctors or the pediatrician to explore those services available in your province. So I just want to put this slide of evaluation of ASD, because since parents are not aware what it takes to get the diagnosis of autism, I see some families and they say, yes, we have been assessed for autism and that was ruled out. And then when I asked them how you were assessed, they said, my pediatrician talked to us for 5 or 10 minutes and they said that you have no autism. So I just want to say that autism is not diagnosed in 5-10 minutes. There's an extensive evaluation of autism which need to be done by a trained psychologist or a trained physician, and it's a group of people who do the diagnosis. So and if they say that's done in half an hour, that's not possible. So there are a couple of things I like my parents to be aware that what does evaluation of autism mean, so then they are not misguided by somebody telling them but just talking that they don't have or they do have autism. So clinical history and observation of the child are basis for diagnosis of an autism. There are several questionnaires, and the one key thing for young children, the other questionnaires, and there's another which is a key standard is the Autism Diagnostic Observation Skill, which is called an ADOS. This is a gold standard test, which is done over an hour or so by a trained psychologist or a trained physician who run this test to do a testing. And the one other test is called ADI, the diagnostic interview. This is a testing done with parents, and it's over 300 questions done with parents. So if the parents come to me and say that the testing was done in half an hour, that's not possible. It's done in multiple settings. multiple visits, and an extensive assessment if you have a thorough autism assessment. And medical examination always a key here to rule out other condition, which could be such as epilepsy is common to rule out those things as well. So I just put this slide. I don't need to go into these. There's a lot of rating skills used over different provinces and by different psychologists. And just to want to make you guys aware that it's an extensive assessment. So now we come to managing the autism. There's no cure for autism, but the goal is to help the person gain skills and improve daily life, including school, work, relationship. So it's an individualized care. Every person with autism has a different need, and that need to be cured. Now, don't put off this word, there's no cure for autism. The prognosis of the child, which I'm going to talk later as well, is much more better who get an earlier got treatment rather than person who does not get the treatment. So what are the areas of target intervention for the child with autism? It's the communication skills, engagement, motivation, attention and concentration, social skills, play therapy, as I mentioned, that they prefer to play alone, and a lot of play therapy helpful, cognitive and academic skills, behavioral challenges, motor skills, life skills. So there is a lot of areas which could be targeted, again, according to the individual's need. So one very common question is asked to me is there a medication for autism? So there's no clear medication for autism, but as I mentioned earlier, the autism could be associated with a lot of other conditions. So medication could be used for those comorbidities, such as that there's a medication for ADHD, which can help day and night difference if you treat the ADHD with medication. There are SSRIs, or we commonly called as antidepressant medication. They could be used for anxiety, depression, OCD, which normally very co-accompany the autism. And antipsychotic medications can sometimes be used if the behavior is quite dangerous or out of control. So these are some of the medication could be used to aid or help the quality of life of the child with autism. There's no any clear medication for autism. So the key thing in starting the management or the treatment of the autism child is having a family education. So if I'm a parent and I've been told your child is not easy to put on socks, he's not defiant, he's not an oppositional kid, he's having sensory issues because of that socks, then you have much more understanding to deal, and then you can find out the ways, maybe some socks with cotton or maybe no socks. But then you are dealing with that behavior easily. So learning as much as possible about autism spectrum disorder is a key thing here. Providing consistent structure and routine. As I mentioned, that sometimes they have a hard time adjusting to new things. So if you provide structure and routine, that's a key. Connect with other parents of children with autism, because again, each parent could have a different experience and you learn so many things from different parents. Seek professional help for specific concerns and take time for yourself and other family member. So I just feel sometime, and if I have a time, I can give you some example of a case that sometimes just learning about what is autism, that helps so much. Even if you don't, that's the next step, that you go to the doctor and seek some treatment. But just understanding why your child is doing this, it makes so much easier for parents to understand and deal with it. So one type of therapy, which is again, so when we normally do an assessment for the management, we always like the autism patients and the parents to connect them with the behavioral consultant and behavioral interventionist. So there's one kind of a therapy which is called as applied behavioral analysis. And that is a system of reward-based training that focuses on teaching particular skills and behavior, such as everyday tasks is specifically developed for autism. So it's a kind of it's for individualized. Again, different child have different problems, and that applied behavioral analysis could be done according to the need of the child. Occupational therapy. Now, a lot of time I see that even in my professional career, a lot of time that is something very commonly missed. And I sometimes feel that sometimes it's more beneficial than behavioral therapy. Why? Because as I mentioned earlier, a lot of kids with autism have sensory issues, and a lot of their problems start with sensation like noise, touch, texture. And a lot of this occupational therapy can play a crucial role in the life of the children by helping them learn a lot of those sensory skills. And also it can include fine motor developmental skills, gross motor skills like physical abilities, coordination, and balance. They can help them learn daily living skills, sensory integration, emotional regulation. So, occupational therapy could be a lot more helpful to deal with those things sometime than behavioral therapy. And again, it depends on different individual needs. Speech therapy, as I mentioned, that there could be a delayed speech for autism, and then again, finding the right words or vocabulary. So, speech therapy may include communication skills training, verbal and nonverbal, and focus on speech pragmatics, like ability to use the language in the social setting. So, sometimes they don't know what word to use when they greet or meet somebody, or when they're talking to people. How do I communicate? And a speech therapy could be a lot more helpful. Again, it's about what different needs are, and the speech therapist can work with that. Play therapy. Autistic children also prefer playing alone. Play therapy can help them to connect with other people and both children and adults doing the play activities. So it can improve their communication skills, their social skills, their emotional skills. Social skills training. That's a key thing with anybody with autism. The child can be trained, again, to interact appropriately by sharing, collaborating, taking turns, asking and answering question, usually in a group setting. So those are the couple of management skills. Now I just want to talk about the prognosis or the outcome. So the key is that the age and intervention can impact the long-term outcome. As I mentioned, that the earlier you provide, so it makes sense. If my child is 4 and have poor social skills, diagnosed with autism, and start having them learn the social skills, how to interact with people. So he go in kindergarten, he go in grade 1, he can learn over the years and develop some positive social skills. But if my child is already 17 and I've passed all those years with being aloof, being bullied because they cannot communicate or they cannot socialize, now when they start treatment at 17, it's already too late. So maybe if they started the treatment and learning those social skills earlier, the outcome is much more better than if it's late. So research has shown that earlier the child is treated, the better the prognosis will be. Outcome studies of children diagnosed with autism have shown that although 40% may show overall improvement during adolescence, as well as some of them can deteriorate. And again, the deterioration could be related to some autistic adults who are not intellectually impaired tend to improve more than somebody who have intellectual disability can have a little bit more down prognosis than the others. But again, the key thing is targeting the intervention at early age. I just want to put this slide here because as initially has been told about the stigma too. So commonly in our community, mental health remains a stigma, not only about the autism, any mental health remains a stigma, but things are changing now. But why autism? If my child have behavioral difficulties, I rather have a child with behavioral difficulties than have a child with autism. Because autism, oh, I don't want my relatives or friends or community people to know that my child has autism because there's so much stigma attached to it. This could be because there is a representation of autism in media has perpetuated incorrect myths about the illness. This include characterizing autism as a very shameful and burdensome for family members and advertising some fake cures for autism. This also include the publicizing of long disproven argument around some vaccines. As a result, parents can have a child with autism behavioral difficulties, but are very reluctant to have the diagnosis. So they prefer that if I'm going to take my child to a birthday party and they know they have autism, they would not invite him. But that's a very common misunderstanding that's something you need to understand that once you have a diagnosis, you're eligible for more treatment option. The prognosis for child getting better and family getting better are more. So last slide, take home message today. Autism presents itself in a vast variety of symptoms. So don't be put off that if you have some symptoms and another child in the class is having other symptoms that my child does not have autism. The key thing is to explore. Every child and individual varies in their presentation. The earlier you seek diagnosis, the better chances of getting early treatment, and outcome of children with autism is better who start the treatment early in their life rather than later. So that's a key home message. And thanks again for listening. And I hope that makes some sense. I try to make it as simple as possible so people can have some understanding about autism. And yeah, thanks for listening.
Thank you. That was an amazing presentation. That was I learned so much. Even though we had a presentation earlier, like we went to a respite center. So they have that in Oakville, where I live, that they have a respite center, which
Mhm,
is such an amazing thing, that where they give the parents a break. So
mhm,
I think, of course, it's not covered by government. It's partially covered,
mhm.
but we went there, and she explained it to us how they take care of the children there, so the parents can have a break. Of course, you have to pay for it, and it depends, and everybody's divided into different categories, and depending how much need it is, depends on the cost too.
Yeah.
So it was amazing going there, and we tried to support that center too, because they were asking. And it's a duty as a Muslims too, because there were some Muslim parents there too. Even
Mhm.
though we think as if autism is a not a Muslim disease, but it is. There are, and you said something which was it hit me, that it is getting more prevalent.
Yeah, there are
It's a
some
personal
people.
question. Why did you say that? Is it because people are diagnosing it, or
Yes.
is it because
No,
it is getting worse, like the
no.
environment is so
I think
unhealthy?
so. The more thing is that a key thing I didn't put it here. When I talk to a lot of parents, and this is amazing to hear from them. And when the child is eventually diagnosed with autism, they come to me and they said that my maybe the father or mother said that I always had that symptom and I didn't realize that I might have autism. So maybe this is because that it's being more awareness is there, it's getting more diagnosed. People are understanding. So a lot of parents, like I always hear this that the parent says that my grandmother always had those symptoms, but we never knew that this could be autism. So maybe this is again according to the awareness, or maybe some other issues. But yes, there's a lot of saying that autism prevalence is increases, which one of the idea could be because of getting more awareness and getting more diagnosis.
Okay. So yeah, it is getting, and also it could be related to the environment being so, we're cutting down so many trees and stuff, and the environment is such a big mess. So that could be it too, right?
Yeah. Yeah.
Okay. So uh, some of the questions are, one of the people who were listening to your talk said, I see a lot of people struggling in understanding what kind of funding is available. Can you
Mhm.
highlight this as well? You did say something of it, and each
Yeah.
province is different, right?
So the problem with the funding is that it's available. Now, I can only talk about the BC. I don't know about the Ontario and other provinces. So the funding is again done once you have a diagnosis done by autism by a registered body, not like you go to the family doctor and say you have an autism. You need to prove that you got a diagnosis from a clear place. Now, the funding in BC, the way it works is like it has an age gap. So if you're 6, it's more. If you're 9, it's less. And then after, as the child grows, the funding reduces. And that's done by the social worker in our province. So I don't know much about it, but definitely for different provinces, you need to explore that. The key thing again is to get the diagnosis done. And once done, you can always, there is a link attached to when the people who does the assessment, they always have a connection to those services where you are eligible for funding. So yeah. So that's a key thing. I'm sorry, I'm not aware of the funding other provinces, so I cannot speak about that.
Yeah, yeah, each province is different. And so you did say that once the child is older, the funding becomes less. Is
Yes.
that true?
So yes. So in our province, it's that's something that we need to be aware. That's why I always ask my parents to get the diagnosis earlier. When they are younger, they're eligible for more. How much more or less? Again, I don't know the number, but it's more when you are having when you are younger as compared to when you get older.
Okay. But you did say in your presentation that sometimes the signs of autism come out later, right?
Yes.
Didn't you say that? So then the
So it's
funding
not.
should be for later too.
Yeah, that's a key thing. So it's not about the sign comes out later. Signs are always there. They're picked up later.
Oh,
So,
picked up later.
so I just like to share a very small story. So there was a girl who was functioning so well. She was in grade 8, but she was functioning, working at grade 11 courses, very high IQ. But her problem was that she had a fight with her parents every day. and she was blaming that her parents were hitting her. For this reason, the police were called, social worker were called. She was coming to presenting to Emerge every other weekend because she was expressing that her parents were hitting her. Parents come around, they said, no, we are not doing it. It was it was an issue for many years, and she was coming to our clinic, seeing one of my colleague, and nobody knew what's happening there. They admitted her to the hospital. She's not psychotic, she's not depressed, but she kept on saying that my parents are hitting me. As a result, the ministry need to be involved, the police involved. So the doctor they were seeing, actually, the parents were so upset that they fired the doctor. Eventually, she came to me in the very first visit. She came to me and she come across so rigid and so stubborn in her presentation. And I asked some symptoms and I said, did you have friends? And she said, no, I always love my parents, but parents are not hitting me every day. And I was like, what do you mean by hitting? Oh no, they shout at me and then they hit me. So when I spoke to the parents and her, I was like, this is high functioning autism. And parents were like, really? No. And they went for the assessment. And believe me or not, this was a high profile case because the parents were very rich people here and the police were involved and so many ministry people were involved because of these allegations made by the child. They went for the autism assessment. She did got diagnosed. And the very first day she got diagnosed, parents were told that her saying of parents are hitting me is because she's angry on you. And she's using the word the parents are hitting me. And then they did full thorough assessment. She was diagnosed with autism. Parents were told that when she's rigid, don't argue. There are different ways of dealing with it. And from very that day she's been diagnosed, there's no hospital visit, there's no police involvement. She's doing so much better. So what I'm saying is that autism is there, but sometimes it takes a long time for people to understand a lot of things which are happening are autism, and that's not being picked up.
Yeah, that's so sad. May Allah help us through. I don't know how many kids I've heard, like, especially when they're teenagers, the parents complain. Allah alam, how many of them have autism? Because some of them are just difficult
Yeah.
without autism, I guess. But Alhamdulillah, yeah, it's a good. So you also mentioned that doctors themselves can misdiagnose it. Like you were saying,
Yeah,
like they
sometimes
take
that
half an
because
hour and they decide, but then it's. And
yeah,
I've heard of people like from that there's something wrong with the child, and I even mentioned it to somebody, and I said, and she goes, no, I took him, and he was not he's not autistic. They told me, but I never asked her how long or how short the visit was. But it seemed like, the teacher did it, or even though my daughter is a teacher and they do learn, but of course not as well as you, who are a psychiatric, for children, who would know right away, right?
yeah. And
So we
that's
have
why
to.
I mentioned this in my slide too, that if you feel like your doctor is not understanding, change the doctor too. It's about,
Yeah.
first of all, understanding about yourself. Did some research about it, read about it, and then talk to the people. Again, there's a lot of autism society in every province, which provide a lot of help for the parents and education. So educate yourself, and then obviously seeking out treatment. Now, seeking out treatment, not every doctor have a same view or have a training differently. So maybe if you're not satisfied, go to another doctor and see what's happening. And there are a lot of developmental pediatrician who also do those assessments. So maybe look out for those.
Hmm. I really liked what you said about how that quote you quoted, that every child, what you know about autism about that child is only about that child. It's not a common thing with everybody. So each child is different.
Yeah,
So we have to be very careful about that we don't just generalize. We can't, because each
exactly.
child is
Yeah, and
different.
that's
But
why I mentioned that even two siblings, and actually this happened just the day before yesterday. I was seeing a child, and my therapist said that no, he may not have autism. And I was like, maybe this is autism. And I spoke to the parents and I thought that they didn't knew anything. And we talked for an hour and a half. And they, as they were leaving, and they told me, yes, my younger son have autism. I was like, really? You knew about the autism and then you just presented. It's like, yeah, but he's different. Okay, so maybe he has also autism. So yeah, it could be very different.
even brothers or siblings can be different. Yeah,
Very different.
subhanallah. Yeah, so each child to itself.
And
um
Zakia, I see there's some question. Do you want to take some
Yeah,
questions?
I was gonna say, I see a lot of people's. Is there an association? It's hard to understand. Sometimes with stroke of anterior horn or the lateral ventricle in babies.
So that's something, again, a premature baby or any of the medical condition could be related. But again, it could be any condition. It's not any specific thing. Any condition which can cause some damage to the brain or developmental issues can lead to. But again, there's no any specific link with that or anything.
Somebody asked, what if other children are not talking to the autistic child or the
Yeah.
children?
I can talk at length about it. So that's the main problem, because the children don't talk to them because they find them weird, or they find them that he doesn't respond the way, because the child with autism lives in their own way. They have own way of thinking. They have own way of communicating, and not every child around them understand. And that's the key thing, that once we get the diagnosis done and a school knows that the child have autism, and that's why the bullying cases are very common in autism, because the child, nobody understand why they are like this, and they get very easily bullied. Even a normal child, this bullying is so much common in our schools around here. So that's why I always ask the parents to get the diagnosis done, help. And once you get the diagnosis in BC, the school get also educational assistant or some support for the children with autism. And once the teacher or the educational assistants, they know about the child is having autism, they can make understand, other people understand, or other kids understand that why they are like this. And maybe that helps the situation a little bit. Although it's very tough when you are 8, 9, 10-year old, or especially in high school, that the kids don't understand and they bully you. But the key thing is getting the diagnosis and getting a help for them. So then the school can understand, the teachers can understand, and they can guide or educate the kids as well.
I just wanted to tell the audience that if you have questions, you can write them in the chat. But I have some that are already. Somebody asked about tic disorder at Tourette syndrome. Does that cause it?
It doesn't cause it, but it's very commonly comorbid or occurs with autism. Tic disorder does not cause autism, but a lot of kids with autism can have tic disorder.
Okay. Can a child therapy doctor help them out? I guess so, right?
What therapy, sorry?
Child therapy doctor. Can we reach out for them to help?
I'm not sure what you mean by the child therapy doctor. Like, are you talking about a psychologist?
I don't know. This is what
sometimes
was written. Sorry, I didn't ask.
So if there's a child therapy doctor, sometimes they are called as psychologist. Not every psychologist is trained to do those testing, which I mentioned, the ADOS and the ADI, which is a gold standard testing for autism. Not everybody is trained in that. There's a special training required to do ASD testing. So if you're a psychologist or a child therapy, I'm assuming that means that psychologist or counselor is not trained, they cannot do the testing. If they are, they can do the testing.
So what is it called again? What is the qualification for testing?
So the testing, they have to be ADOS or ADI trained. They have to be autism assessment trained.
Oh, ADOS. Okay. Yeah, the ones you mentioned in your thing. Yeah.
Yeah.
Trained. Okay. So that's the type of doctor we should go to get it assessed.
Yes.
That's
so
the proper one.
In BC, there, unfortunately, I do this presentation. I always give information to parents to seek the autism testing. But when they ask me where to go, unfortunately, the government body who do the testing here could have a 2-year or more wait list. But there are a lot of private agencies which cost a lot of money, but it's still they can do a good assessment for the autism, and that's another way of doing.
Okay. There's another question here. That's a very nice I really like that. I want to know how we can help anyone support a parent that is having a child who's having a meltdown in public, autistic child having a meltdown.
So again, that's a very good question.
Now, yeah, I loved it.
So that's what the applied behavioral analysis, and that's why a lot of time I ask even some time, because that's a key thing, and that's I'm thankful whoever brought this question. So the key thing is that sometimes I see the families who are having this child with extreme meltdowns, and their life is like a hell, because every day they cannot take any child, they cannot go to any social gathering. They are housebound now because the child is behaving so badly, and they are waiting for autism assessment to be completed, and sometimes it takes a long time. I always ask my parents that if they can afford, don't wait for the autism assessment, but they can hire a behavioral consultant. And what the behavioral consultant do is they identify those behavioral issues which are leading to those temper tantrums, as you mentioned, those meltdowns. And they can talk the parents, or they can educate how they can educate them how they can deal with those behaviors. So the way it works is that every child have a different problem of having a meltdown. Like as I mentioned, every child is different. So it's about getting identified, and that's what applied behavioral analysis is. That you identify what are the causes, what is the behavior, and what is the consequence. So you work with the behavioral consultant to identify what you can help as a parents to cause or to act in the situation to help the meltdown. Now, again, it's a very broad question that I cannot just answer just saying how I can stop the meltdown. But once you know why your child is doing it, then it's easy to help. And that's why sometimes few sessions with the behavioral consultant would be helpful.
Okay. There's another one. I'm a day home educator. One of the children, 4 years old boy, addicted to watching a fan video at home and insisting on showing him this fan video. He likes all moving things. What should I do?
Again, that's not a question for me. That's another question that you need to connect with a therapist or behavioral consultant to work with that behavior. That's a very typical behavior of autism spectrum disorder.
Mhm.
That's something that you need to identify how you can help. That's a fixation you're talking about, that he's
Yeah,
fixated.
he's fixed on that. Yeah.
Yeah, fixated. And he's 4 year old. So obviously there's a need for behavioral intervention with their family or whoever is taking care of him for them to work on that. There's not any straightforward answer that I can give for that, but that's a work that you need to do with your therapist.
But I was wondering, just personal question, like, do they get over these addictions, like, and they go into another addiction, right? Do they do that?
So the fixation can change over
Yeah.
time. It differs from different to individuals. Sometimes they persist for 6, 8 months, and then it's something else, and then it changes to something else, and then it changes to something else. So it
So maybe
differs.
just fulfilling a need in them, maybe some kind of a need.
Again, that's an assessment that sometimes those behavioral consultant can do a lot more better in identifying those behaviors and working with those behaviors. And I know there's not a straightforward answer that what I do, my child is doing this, but believe me, those therapy makes a lot of difference. So the key thing um,
All
is
the different therapies you mentioned, right?
yeah,
The
yeah,
speech therapy, the occupational therapy, the behavior, all of that. So go
exactly.
to those ones.
Yeah,
Reach out for them. Thank you. Another one is my daughter has ADHD in
attentive type.
intentive in attentive and
I can read
AD
that, Zakia. Yeah. So my daughter has ADHD inattentive type and evaluated
inattentive. Yeah, I couldn't
by
use
a
that word.
by a child psychologist. Does she fall on the autism spectrum? So this is Mariam. Thanks, Mariam, for your question. So ADHD, yes, there's two type of ADHD, which is hyperactive type and an inattentive type. Um, so she's evaluated for a child psychologist. The ADD symptoms are very different from autism. So the ADD means that your child is having a hard time, a struggle to concentrate long or focus for a long period of time. Um, Once medication, I don't know how old is your daughter, but sometimes medication give a very good profile, improving their attention and concentration. Now, your question, does she fall on the autism spectrum? Now, again, any of those symptoms which we discussed today, if you feel any of those are there, she need to have an assessment for that. Now, having said that, that all ADD or all ADHD don't have autism, but some of the autism kids can have ADHD. So if your child have ADD, that doesn't mean that she also need to have an autism. If she has any of those symptoms which we discussed today, yes, seek some help, get some assessment. But if not, then it's just ADD. ADD does not need to be with autism. I don't know whether if Mariam, if that answers your question.
There's a question from Fariha. Jazakallah khair. My son was diagnosed from the pediatrician at the age of 14. Do I still need to go for assessment by a professional? What was he diagnosed? She didn't say. She said she
So
forgot the
Faria,
name.
if your son was diagnosed by pediatrician by autism, some of the pediatrician do a full assessment. They are trained in ASD assessment. So if that's your referring, which I talked earlier, that sometimes people say that my son is diagnosed within half an hour with autism. So I don't know about the credentials of the pediatrician, and some of the pediatrician does do a formal assessment for autism, and make sure that after every assessment for autism, there's a full report. There's a full report done, which give all the breakdown of all the testing done and all the report. And sometimes there is an occupational therapist or a speech therapist attached to that pediatrician or psychologist who do a full assessment. So when you say, do I still need to go for an assessment by a professional? Pediatrician isn't a professional. I'm not sure if they have that training, and that's something you can check.
Thank you. My daughter is diagnosed by mild autism, but she don't want to. She doesn't want to make friends. She doesn't talk on social life in future. Hard to survive life in marriage. How to deal? How can I make socialize any therapy?
I make socialize anything. So Samina, I can see your so that's the mild autism, that's a main key thing, that they doesn't want to be with people, doesn't want to make friends, or actually it's not that doesn't want to, it's difficult, it's hard for them to make friends because this is the way the brain develops, that they have no social life. And so yes, it's hard to see the life in marriage. I would highly recommend that you connect her with a therapist to have some social skills training. That's a key thing with all the autism kids, that you work on the social skills training. And again, having said that, that how much that will improve it differ on different individual, but there will be some credibility or some improvement if you start working on that social skills training. So you at least can make a little bit things easier for her socially.
I'm self conscious. मुझे थोड़ा चुप कर, उनका सवाल पूछना मत, तुमने कहा मुझे हेल्प
Sorry,
देना.
somebody please mute yourself. Another thing is another very interesting question. I like that. Can you talk about the nutrition and supplement vitamins that autistic children can take? I heard that children with autism should be on a gluten and dairy-free diet and take certain vitamins. Is that true?
Again, so Fatma, thanks for your question. That's a very nice question. Lot of people talk about that. So I just have to identify that I'm a doctor and only work on kind of what is FDA or research approved. So there are a lot of organic stores which sell a lot of things. Until unless there's a research or kind of they are approved by the Health Canada, I would not even talk about them. I know that a lot of kids talk about these vitamins with ADHD and autistic kids. Definitely, the vitamins are good for supplement, for improving your brain health, for any other normal kid or any other kid with autism or any other kid with any other diagnosis. The vitamins or supplement are helpful if your child is deficient in that. I don't know if there's any research specifically on those dairy items or gluten. And again, my background is a medical background. So we mostly deal with what is research based or what is being FDA approved or Health Canada approved. And there's no much thing about that.
It's like a neurological defect. It's in your brain. So
It's your brain. And I
yeah.
know that if, like, let's say if your child have a flu, you give them vitamin C and you help them. So same thing, if your child has having different difficulties, you improve their nutritional value by giving them right nutrient and right kind of vitamins and right. But I don't know how much that makes a difference. Again, it could be the same thing that you're giving a child a vitamin C in flu, or you're giving different vitamins to a kid with autism.
Do smaller special education program benefit most children with autism?
Say that again.
Do smaller special education programs instead of sending them to school to make maybe in a smaller program, like a smaller personal classes with less kids. Would that help the autistic
Yes.
child?
So again, it's this is Sophia. I can see you that a lot of kids with autism. Problem is when they're in the mainstream school, they have people around them, as somebody mentioned earlier, that nobody talked to my kid. That lead to a lot of depression, anxiety, bullying, and that lead to poor self-esteem and poor self-confidence. Sometimes those special education program are much more helpful because the people around you identify or understand what your needs are, and there's a less chances of getting low self-esteem or less chances of being bullied, and then more chances of getting more individualized care. So if that program is available, that's much more better, and obviously it's according to the need. Some of the, as I mentioned, that some of the kids with autism have very high IQ, so they can function very well in the mainstream of school. But if there's intellectual disability or the lower IQ, then those special programs are really beneficial.
Thank you, Doctor. How do cultural factors influence the perception and understanding of autism, and what steps can we take to promote cultural acceptance? That's why one of the reasons we are doing it is for this.
So
You
I
know.
can tell you that, yeah, Farheen, you wrote this question. That's a very important question. So one of the people, like I'm from Pakistan, and then if you go back still now, when I start looking the kids around, I'm not judging them, but I can see so many problems. But the problem is that the people don't understand that mental health is an illness, or mental health is something to talk about or to seek treatment. And that's a reason that, especially with your children, you see a lot of parents going back. That's not in Canada, but if you visit Pakistan, you see still a lot of parents are beating their children or hitting them or so rude and dealing with them with so odd presentation. And that's something the culture come in play when you see a lot of people here with other background. They are so polite and they're so reasonable to the parents, and then the perception can change. So on the top of the journal parenting issue, when your child already have an autism, then the understanding need to be much more higher. And then when you say what steps can we take, so that's something that what Zakia just mentioned, that we are trying to bring some awareness. First of all, and even before autism, I just like to say that when I see my Pakistani parents, the way they are parenting their child is so different from what we see the other parents from a different background doing with their children. And it does make a lot of difference. Like some, we just don't value our kids that much or deal with them as politely as other cultures might do. And maybe even to begin with, without autism, sometimes that can induce a lot of low self-esteem or poor self-confidence. So first of all, to begin with, cultural factor is about, key thing is about the nice parenting issues and nice parenting skills. And obviously then learning, understanding of autism, like through these webinars, we can take more steps to promote this cultural awareness. And then again, about the stigma, get them diagnosed, seek the treatment. There's no harm or there's no shame if your child have autism. You can bring them to the setting, but then people who you are bringing them to, they can understand too once after a while that yes, this is something their child have. They have some special needs, and they can also modify their things according to it. So it's all about education, and I think so that can promote the cultural competence.
And it's also, I would like to add to that, that, our religion, in our
Yes.
religion, it's just the ayah that we read, that you should never be grief, you should never think bad, that, the way Allah, it is a test from Allah, right? So we all will be tested in a different way. And being at Muslims, we should be more acceptable that, this is what Allah created this person like. And even though whatever it is, he's a person that we should respect, we should love, we should, because this is how Allah is testing. And he's for for us, he's a test, but then for him, we are a test if we don't treat him nicely, right? So we have to be very careful because we will be asked.
I
And
see.
so education helps, but knowing your religion also helps. And that's one of the things that Ikna sister does too. We, connect people with the Quran too. Then another one was, there's a couple of questions about rocking. So they
Yeah.
are rocking and repetitive behaviors.
Yes.
So just having that, is that autism defined or no, right? We have to have
Again,
a
let's
couple
need a
more,
full
right? And
assessment.
just
Yeah, I see a lot of kids, people have written about what to do with the child is rocking, and that's again could be one of the repetitive behavior where the child with autism have. It could be a way of soothing. It could be a way that they're expressing themselves. It could be a way that they are, or they may have a tic disorder. There could be a number of things there. So rocking could be anything. Again, they need an assessment for that, and the treatment normally include a lot of behavioral intervention. So sometimes the kids are, yes, somebody wrote that it could be to regulate themselves. It's again, you need to connect with the behavioral consultant to talk about that, how to deal with the behavior and how to modify it into something else. Because sometimes what the occupational therapist or the behavioral therapist do, they change that rocking into something else. They have those fidget toys, they have those fidget, there are a lot of sensory toys they could be given which they can use in their hands to help them soothe other than just rocking. So there could be multiple ways of dealing with it. Again, to connect back with the occupational therapist or behavioral therapist.
anyway, there was one more last question that one of the girls asked, young mother, I think. How does she know if it's speech delay or it's autism?
So that's a, yeah, good question. So speech delay is one of the early warning sign. You could know this assessment once you go to the developmental pediatrician. They not only assess the speech, they will assess for everything. So this is something, as a mom, if you have a speech delay, bring them to the help, bring them to the screening, and then you can take on from there. If it may be just a speech delay and it can be helped, if there are all other signs which were mentioned above, they can do further screening for that. So the key thing is then bring them to the developmental pediatrician, or there are a lot of public health offices, developmental clinic, bring them there and get those assessment done sooner rather than later.
Jazakallah khair, Dr. Muniba. Okay, so I will try to end the lecture now, webinar. Thank you for your time. We learned a lot, and I hope we can, remember all of it, and especially the stigma that goes with it. Sometimes, as we know, Dr. Muniba said that, um, you know, um, we might think, but they're just wired differently, and they are still human beings, and we need to treat them nicely. And the stigma that that there's something wrong with them. It's not. It's just that they are different. They think differently. They act differently, and we can help them be come back to the society norms by helping them, by getting the right help. And so I will just quickly summarize that there's a vast variety of them. So we cannot judge just by seeing one sign. Oh, this boy is autistic or this girl is autistic, and they present in various different way. They can be not very smart, but very, very high IQ too. So we should not judge again that, and then earlier you seek help, the better it is for the person that has it, the more able to help him get, into be able to be accumulated in the society. So these were the few of the things that she said, and this is what we took from it. Alhamdulillah, we learned a lot of other things. And Jazakallah khair for everybody for coming and for your questions, which made us all understand the webinar better. Inshallah, there are other conditions that she talked about. Like there was like a whole slide on it. And we will try to hold more webinar because we saw how popular this one was. Inshallah, we will continue. ICNA Sisters wants you to become better human being, better Muslim, better mother, and better citizen. So, and one of the questions is how to help when somebody is going through this tantrum, and if that person, my personal would be that not to first of all look down and try not to get in between the child and the mother, but if she has other children, take care of them. If she has, groceries or something, like hold her bag for her or something, so that she can attend to the child properly. So that would be one of the ways. Anyways, I'll quickly do a little bit of a dua, and then inshallah we will end. And Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wal asr innal insana lafi khusr illa alladhina amanu wa amilu salihat wa tawasaw bil haqqi wa tawasaw bis sabr. Subhanaka Allahumma bihamdika nashhadu anna la ilaha illa anta nastaghfiruka wa natubu ilayk. So I will try to thank the CE department for holding this webinar, because we all learned so much today. And I wish Dr. Muniba Faraz was here in Toronto, so we could have gone and gone to her for her assessments. And maybe if you ever come here, please let us know so we can come and see you. So Jazakallah khairan kasiran everybody for coming. Inshallah, we will end the webinar, and we have recorded it, so it will be uploaded on YouTube, and so you can always see it again if you missed any slide, and that's about it. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam. Thanks everyone for listening. Thank you.
You're most welcome.